Hello guys and welcome back to my channel.
Today we're gonna learn about schizophrenia. One guys, you can read through the slides, but I'll be explaining in simpler terms as well. So now, what is schizophrenia? Schizophrenia is a long-term mental health condition that changes the way the person thinks, feels, and behaves, often in ways that are confusing or troubling. Imagine feeling unsure of what is real or not. This is common in schizophrenia. Positive symptoms involve unusual or exaggerated behaviors that aren't typically seen in a healthy individual. They can include hallucinations. These are perceptions of things that aren't actually present. The most common type is auditory hallucinations, where people hear voices or sounds that do not exist. Visual, olfactory, and tactile hallucinations can also occur. Delusions. These are strongly held false beliefs that aren't based on reality. For instance, someone might believe that they are being targeted or followed, paranoid delusions, or believe that they have special powers or a unique identity, grandiose delusions, disorganized thinking. This involves trouble organizing through logically. A person may struggle to maintain a conversation with a speech, jumping from one topic to another in a way that can seem confusing or nonsensible. Normal motor behavior. This can include range of behaviors from agitation and restlessness to catatonia, where a person may not respond to their environments or hold unusual postures for a long time. Now, in simple terms, positive symptoms in schizophrenia are unusual experiences added to a person's normal perception of reality. They include hallucination, sensing things that aren't real, like hearing voices or seeing things that others don't see or are not there, and delusions, strong feelings, false beliefs, such as thinking someone is out to get them, paranoia, or believing that they have special powers, disorganized thinking, trouble organizing thoughts, leading to deep thoughts, or leading to speech that may jump between topics or seem nonsense, uh, abnormal motor behavior, unusual movements like restlessness, or in serve cases, staying still and unresponsive, catatonia. These symptoms disrupt a person's connection with reality, making daily life very difficult. Negative symptoms are things that are taken away or reduced in a person's normal experience, like their ability to express emotions, feel motivated. Examples include flat expression. The person might not show much emotion or expressions on their face or on their voice, even if they're feeling happy, excited, or want to talk about something which is expressive. Reduce speaking. They might talk less or seem uninterested in social interactions. Loss of enjoyment. Activities they used to love, they enjoy no more. That feel fun or interesting. Low motivation. They may find it hard to start or finish everyday things like cleaning or showering. Now, in simple terms, negative symptoms in schizophrenia are things lost from personal usual experience. They include flat expression, showing little emotion in face or voice, reduced speaking, talking less or seeming uninterested in socializing, loss of enjoyment, no longer finding joy in activities they used to enjoy, low motivation, struggling to start or finish daily things like cleaning or showering. These symptoms make it hard for a person to feel engaged, motivated, or can't help them connect with each another. Causes of schizophrenia. There is not one single cause of schizophrenia, but several factors increase the risk. Genetics. Schizophrenia sometimes runs in the family, so genetics may play an important role. Brain chemistry and structure. People with schizophrenia often have differences in brain chemical like dopamine or structure in brain areas. Environment. Stressful events, certain virus, or malnutrition before birth might increase the risk of schizophrenia. Drug use, especially in teen years, can also trigger schizophrenia. I think that's pretty basic, so I'm going to move ahead. Is schizophrenia diagnosed? Diagnosing schizophrenia can take time. A doctor looks at the symptoms over time and checks for other health issues that could cause similar problems. Generally, symptoms must take 6 months with at least 1 month of severe symptoms to make a diagnosis. So basically, a doctor looks at the symptoms and other health problems that a patient might have that may cause other problems like schizophrenia, imposter syndrome, bipolar disorder, or so. And then the doctor is making a decision if the person has schizophrenia according to the symptoms and how is it supposed to be diagnosed. Treatment options. While there isn't a cure for schizophrenia, treatments can help manage symptoms and improve quality of life. I'll just not go into detail, but I'll just tell them there are medication, therapy, family support, rehabilitation programs, and community programs. Isn't that easy? We have reached an end to this video, so I'd like to reward you all with a short summary of this video, which is schizophrenia is a long term mental disorder affecting thoughts, emotions, and behavior, often causing confusion about reality. Symptoms include positive, like hallucination and delusions, negative, like lack of motivation and reduced emotions, and cognitive, such as memory and focus issues. Causes are a mix of genetics, brain chemistry, and environment. Treatment involves medication therapy, family support, and skill building programs, helping many lead a fulfilling life with proper management. Question of the day. What is the difference between negative and positive symptoms of schizophrenia, and how does it affect a person's daily life? Thank you for watching, and make sure to like, share, and subscribe, and be sure to comment the answer in the comment box.